So on the previous topic, I talked about hypertrophy, which is the adaptation after cell injury. And I also told that some of the cells will also undergo hyperplasia. So now let's understand what is the definition of hyperplasia. It is the increase in number of cells which will lead to increase in the size of organ. In the case of hyperplasia, there will be the increase in number of cells which will lead to the increase in size of organ. What is the mechanism which will lead to hyperplasia? What will happen in the cell? Growth factor induced proliferation of mature cells. Mainly the growth factor will induce hyperplasia of the cells, and it usually occurs in dividing cells. As you can see, in hyperplasia, there's an increase in number of the cells. So only the dividing organ, only the dividing cells can undergo hyperplasia. So there is one point to be noted. This is very important. Let me put a star mark. Dividing cells can undergo both hyperplasia and hypertrophy. Got it? Like dividing cells, it can divide also. So it can undergo hyperplasia as increase in number of cells. But it can also undergo hypertrophy. Okay, this is the point to be noted. Now let's see the type of hyperplasia. As of hypertrophy, there was physiological and pathological. Same in the case of hyperplasia. Physiological hyperplasia and pathological hyperplasia. Okay, let me make a line here. So in the physiological hyperplasia, let me divide it into two classes. One is hormonal and one is compensatory. So what is the example of hormonal? Breast during pregnancy. During pregnancy, the breast will undergo hyperplasia. That means the cells which is present on the breast will increase its number. And the next example is breast during puberty. So what is the example of compensatory? It is liver after partial hepatectomy. If we will remove one lobe of the liver, then there is no any problem. The liver can undergo division and hence it will be formed fully. What are the example of pathological hyperplasia? It occurs due to hormonal excess. Okay, first of all. Suppose, example, increase androgen levels will lead to benign prostatic hyperplasia. And the next one is increase estrogen leads to endometrial hyperplasia. So these are the example of physiological hyperplasia and pathological hyperplasia. In physiological hyperplasia, we have two, that is hormonal and compensatory. But in the case of pathological, it occurs due to hormonal excesses. So what is the example like? Breast during pregnancy in the case of hormonal physiological hyperplasia, breast during puberty. And compensatory is the liver after partial hepatectomy. Means if we will remove one lobe of the liver, then there is no any problem because other lobe of the liver can divide its cells. Hence will undergo hyperplasia. And what about pathological? It's increased androgen levels will lead to benign prostatic hyperplasia, and increased estrogen leads to endometrial hyperplasia. Now there is one very important line which I would like to write, and I will also like you guys to remember it. Please remember this line. Hyperplastic proliferation are a fertile soil in which cancers can develop. Hyperplastic proliferations are a fertile soil in which cancers can develop. Means if there is like hyperplastic proliferation, if there is excess division of cells, excess increase in the number of cells, then that will be like a fertile soil in which the cancers can develop. For example, as I told you of endometrial hyperplasia, remember? hyperplasia. It's the example of what? Pathological hyperplasia. This endometrial hyperplasia can lead to endometrial cancer. Now I think you are able to understand what I was trying to explain you with the help of this statement. So there is one common thing between hypertrophy and hyperplasia, like examples of both hypertrophy and hyperplasia. Let's look. Examples of both hypertrophy and hyperplasia. As I told you, in the physiological hyperplasia, in the hormonal part of physiological hyperplasia, breast during pregnancy and breast during puberty. This condition can also happen in hypertrophy. So, breast during puberty or pregnancy. It's not only the example of hyperplasia, but both hypertrophy and hyperplasia can occur in this condition. And one is uterus during pregnancy. These are the examples of both hypertrophy and hyperplasia. As I told you about uterus during pregnancy on hypertrophy. In which hypertrophy? Physiological hypertrophy. Remember? So this was all about hyperplasia. I hope you understand. Now, on next topic, we will discuss about both atrophy and metaplasia, and hence our adaptation part of this chapter will be complete. And we will move forward. Thank you so much for watching the video. Consider liking it.